in Ukraine. It's 2,000 people that need oxygen to survive. And in fact, if anything, that number has gone up because we have people with injuries, people undergoing surgery who need oxygen. We have children with childhood pneumonia. We have women in difficulties. So oxygen is not just life-saving in COVID. Oxygen is life-saving, full stop. You need it when you need it. You can't wait till tomorrow for oxygen. You can't wait till next week. You can't be put on a waiting list for oxygen. You can't stand in a queue for oxygen. Oxygen saves your life right now. And Ukraine needs that. If we do not get oxygen into the system and other critical drugs, people will die needlessly. Well, they're dying needlessly to start with. But when you see nurses mechanically ventilating infants in basements of hospitals, even the toughest of us, we struggle to watch that. And those heroes who are there, those mainly women, might I add, in those basements who are taking care of those kids. But if you're a 65 or 70-year-old in an ICU, no one can carry you down the stairs to the basement. So many patients in adult ICUs cannot be moved. And they're being cared for by doctors and nurses while the bombs fall around them. It's really important that we don't just break this down into supplies and break this down into commodities that we have to deliver and corridors, and we speak in these very abstract terms around what's needed. People's bodies and people's bones are being broken, people's lives are being lost, and there isn't a health service available to be able to deliver life-saving care. And we can't supply that health service at the moment. So something has got to move and something's got to change to create the conditions in which that can happen. I just could not believe the bravery of those frontline health workers, and they're a shining example to the world of what the health system should be doing everywhere.